Today we'll be discussing cat scratch disease and tularemia.
I'm Chandra.
And I'm Kayle.
Pathogen description. Cat scratch disease is a bacterial infection, and the type of causative agent of cat scratch disease is Bartonella hassel.
For tularemia, it is considered a bacterial infection. The scientific name for this disease is Francisella tularensis.
Morphology. Morphology of cat scratch disease is a small gram-negative bacillus, random arrangement like sphalange, and no capsule, and does not produce endopores.
For tularemia, it is a small gram-negative bacterium described as Coccobacillus. It is also a facultative intracellular bacterium. They have thin capsules composed of mostly lipids. This disease is non-sporing and also requires cysteine to grow.
How is cat scratch disease spread? Through scratches and bite and the licking of a broken skin infected by cat. Cat usually gets a bacteria from cat flea without getting themselves sick. Kittens are more likely to carry and spread the bacteria. However, even if you have no contact with cats, you can still develop spinal inflammation, which is linked to cat scratch disease.
The causative agent spread for tularemia, it can be spread to humans by tick or deer fly bites, handling infected animals, or drinking infected water. The transmission of this disease cannot be spread from human to human. There are several different types of ticks that can transmit the disease to humans, including the American dog tick, Rocky Mountain wood tick, and the Lone Star tick. The ticks listed above can acquire the disease from infected animals and then pass it to humans through their bite. Deer flies are shown to spread this disease in the western parts of the United States. Infections that are caused by tick or deer fly bites take the form of ulceroglandular or glandular F. tularensis. This disease can also be spread to humans by handling infected animals via the skin. This can happen by hunting or skinning infected rabbits, prairie dogs, muskrats, and other rodents.
Signs and symptoms of cat scratch disease. Small bumps, blister, lymph nodes, fever, tiredness, loss of appetite, headache, rash, and sore throat. These symptoms will usually appear after 3 to 5 days. Lymph nodes are usually on the underarms or in the neck areas. Swollen lymph nodes are most common in the kids and are often mild.
Signs and symptoms for tularemia. The signs and symptoms vary depending on how the bacteria enters the body. It can range from mild to life-threatening. For ulceroglandular, which is the most common form of this disease, it occurs after a tick or deer fly bite or after handling an infected animal. A skin ulcer where the bacteria had entered the body will appear. Swelling of the regional lymph glands, usually the armpit or groin. For oculoglandular, bacteria enters through the eye. Irritation and inflammation of the eye will appear. Swelling of the lymph glands in the front of the ear.
Question.
Name one of the signs or symptoms of the bacteria.
Which pathogen can get bacteria from Chandrawati fleas? If left untreated, cat scratch disease, kids gets better on their own within 2 to 4 months without a treatment. Symptoms like swollen lymph nodes or fever goes away without any medical help. Those with HIV or chemotherapy can cause a serious problem. Some of the infected organs by cat scratch disease are liver and spleen, which will swollen, inflamed, or will be filled with pus. Eyes, which will get blurry, redness, or even blindness in the rare cases. Brain will inflammate, confusion, seizure, or trouble moving.
If tularemia is left untreated, research shows that some people have recovered from this disease without antibiotics or treatment, but the risk of having severe complications, including organ damage, is much higher. The seriousness of tularemia varies greatly. Some cases of the disease are mild and self-limiting, while others may have more serious complications, and a small percentage, which is less than 2% of the cases in the United States, are fatal.
Treatment of the cat scratch disease. In the mild cases, often don't need an antibiotic and can be managed with the over-the-counter medicine such as ibuprofen. Antibiotic like azithromycin are commonly prescribed, which helps with swollen lymph nodes and discomfort. In the serious case, people with a weakened immune system may need a stronger antibiotics such as rifampicin and the following.
Treatment for tularemia depends on many factors like age, medical history, underlying health conditions, allergy, and if the patient is pregnant or not. Adults and children, they can use the same medication, just in different dosages, as shown.
Prevention of the cat scratch disease. Research has not found a vaccine for the cat scratch disease. What you can do is wash your hand thoroughly after playing with cats, and do not allow your cat to lick your open wounds or scratch like skin, eyes, or mouth. Use a flea control measure to lower the risk.
Some preventative measures for tularemia are avoid contact with sick or dead animals, wear long sleeves and pants while hiking, never drink untreated surface water, do not mow over sick or dead animals. For vaccines, there are no official approved vaccine for the disease that is both effective or safe. So far, the research is still showing that there are no live attenuated vaccine strains confirmed. Those strains have not shown effective protection against the high-risk type A as it does as type B. Currently, there has been a couple more trials in hopes to develop a vaccine using the mutant strains or a non-pathogenic strain. The difference in the protection efficiency of the LVS strains against the type A in humans and the low-level protection of many subunit or recombinant vaccine candidates have led scientists to consider a live action that developed using the type A strain.
Question.
What was the treatments for both of the infections?
What could you do to prevent the cat scratch disease? Epidemiology and the region of cat scratch disease. Cat scratch disease was first reported in 1930 and was linked to cats in 1950. In 1980, in the US, CSD gained a recognition. Hospitalization ranged from 0.77 to 0.86 per thousand, and the outpatient cases were at 9.3 per thousand. In 2011 to 2013 in the United States, the hospitalization fell to 0.19 per thousand, and outpatient rate decreased to 4.0 to 4.4 per thousand due to the better diagnostic tool and the flea control in the cat. Today, children aged 5 to 9 are most likely to have CSD. This disease is found worldwide. However, in the southern United States have the greater incidence rate with 6.4 cases per thousand due to a warmer temperature that encourages fly activity.
The epidemiology and region for tularemia in 1320 to 1318 BC, suspicions regarding the use of this disease as biowarfare in the Neshtite and Arzawan conflict. The Neshtites may have won by sending diseased rams to the Arzawans. By them sending this, it weakened their military. For 2011 and 2022, 50% of the cases in the United States came from Arkansas, Kansas, Missouri, and Oklahoma. The disease is highest in children aged 5 to 9, and adult males range 65 to 84. American Indian and Alaskan Native people were 5 times higher than white individuals. Many factors that might contribute to the higher risk of this population getting the disease includes the concentration of Native American reservations in in central states, and the socioculture or occupational activities that might have increased the contact they might have had with the infected wildlife or Around 78% of patients reported to have onset of the symptoms around the months of May to September. This could have been due to the coinciding human and tick outdoor activity.
Case reported Cascades disease. A 10 years old girl brought to a Texas Children's Hospital in September 2000 had a 9-month history of illness before admission. Symptoms were fever, muscle and joint pain, weight loss, additionally chronic unexplained symptoms. Initially diagnosed, a previous hospital doctor thought she had a heart infection but couldn't find any bacteria in her blood. Later, the scan showed that the part of her heart was swollen and might be infected on her heart valve. Later, she had been around birds and kittens. Doctors suspected that she might have been infected from the bacteria called Bartonella hessel, which is the same bacteria that causes cat scratch disease. Her tissue sample showed a sign of infection. For the treatment, she had her heart valve surgery and swollen lymph in her arm was removed. She had to take a strong antibiotic such as penicillin and diocylin. She continued her treatment after surgery, but the report didn't reveal how she recovered in the end. Some of the takeaway was the cat scratch disease can lead to a serious heart problem, even when the blood test looks normal. For the right diagnosis, people with the animals should always be informed and undergo special tests.
For tularemia, there was a patient. She was 6 years old. Consumed the meat of a hunted hare 4 days before. Symptoms: rashes on her body, forearm and legs. Initial diagnosis: they did suspect a case of tularemia. An ultrasound examination showed that the liver was larger than normal. The final diagnosis was Francisella tularensis. Treatment: after a blood sample, she was given gentamicin for 2 days. The rash did go away after 2 hours. An interesting fact about tularemia: it is considered a reportable animal disease in the U.S. and has been found in every state of the United U.S. except for Hawaii.
Cat scratch disease. When a cat grooms themselves, they can get a bacteria into the bloodstream, which can cause cat scratch disease. And here are the references. Thank you.